So afterwards, we'll do upcoming events, opportunities. Also, same thing there. I'd love your input on any activities that you are flagging for this next year. And then for our discussion, we'll go into a preview of the Global Consultation on Climate and Health Data Integration, which Kaushik and Nafal will lead. All right, so just jumping into in the news. So this is a report from BCG that was released, I think, a couple days ago, but looking at the how extreme weather is projected to lead to additional deaths, malaria deaths by 2050. And this is, I think, analysis that is familiar to many of us in the call. One of the suggested investments in this analysis is in data and decision-making support tools like early warning systems and other technologies. And so this is, I think, another great justification for the work that many of you all are already doing in creating these early decision support tools. And this is another interesting publication I found on kind of comparing kind of the practical use of research and in-house modeling capabilities for effective infectious disease modeling. And some of these learnings from this publication draw on COVID learnings. So thinking about what was operational versus what information kind of belonged more in the scientific research realm. And so there's some interesting content in there about distinguishing analysis that should be more routinely necessary and accessible to inform real-time operations versus analysis that requires more deeper scientific research for example, long-term control strategies for infectious diseases. And then another thing in there is on funding timescales. So thinking about the kind of natural course on funding in academia, very like grant driven, and what the career projection in academia looks like versus in public health functions and public health agencies. So again, very interesting read I found. And then lastly, the state of the climate report from 2024, this update just last week for COP29 by the WMO. I don't think this is any new news here, a lot of kind of grim news about the climate. One chart I found to be, not very, very discouraging, but I think this is not surprising for this past year, is that this year up to September has been the warmest year on record, and the past 10 years have been the warmest. And we have reached that minimum threshold of 1.5 degrees Celsius above pre-industrial average. So again, nothing new, but a bit discouraging going into COP. And I'm not sure if any of you all have been, were at COP or following COP, but not great news for us here. So I see that we've had two more people join us. Welcome, Mike, and welcome, Sadie. If you could just put your name, your institution, and your location in the chat, that would help everyone else in the call know where you all are from. And I'll pause here if there are any reflections or any other publications that you all have been looking at. Would love to hear from this group, or if anything pops up, to put them in the chat.
Hi, Grace, it's Kate. Maybe what I'll do is I'll put that webinar that I watched prior to HSTMH that was talking info dengue and different phases of implementation and some of the, I guess what I was trying to get at in the presentation was how it's been useful.
Sure.
So I'd be happy to share that. I can put that in the chat.
Yeah, that'd be great. Thank you, Kate. All right. I think we can then move on to our warm-up question, which hopefully we can just briefly touch on. Just trying to pivot into a more lighter, positive note here from some of the grim climate news. I'd love to hear what one accomplishment is from the past year that you're most proud of, either professional or personal. And I can start as people start to think about this. I'll share something of a personal accomplishment. I participated in the AIDS Life Cycle bike ride. For those who are not familiar with that ride, it's 545 miles over a week from San Francisco to LA. And it's a fundraiser for the SF AIDS Foundation and the LA LGBT Center. And it raises funds for community health services here in California. So that is a huge, accomplishment for me. For this past year, I had not done those long of rides before in my whole biking career. So definitely proud of that. But I definitely think my body was also a little bit broken after that. All right, I'll pass it to anyone else who is open to sharing an accomplishment from this past year.
I guess I can go, Grace. It's Kate again, and excellent job on the long distance. That's very impressive. I guess professional accomplishment, and we haven't even started yet, but we've been working for about since 2019 to implement a very large scale seroprevalence study in DECA. So we're very happy, and we've had a lot of logistical and contextual problems. So we are finally ready to start the baseline for this. It's a cluster randomized control trial, but we're finally ready to start collection baseline in 2 weeks. So very happy with our efforts and with the team, all of the team's work.
Thank you, Kate.
I can go, Grace. This is James. I don't know if I would call these accomplishments. Maybe positive momentum is about all I can say at this point. But I feel like we've done a good job of, through various different partners, of having discussions in Mozambique about the need to share data across different platforms and agencies and departments within the government, and have had multiple different government or ministries at the table having this discussion, and also more regional discussions about the priorities and putting together broad level kind of concept notes to address some of these things, from implementing some NASA products into our elimination work in southern Mozambique, to trying to build out some cholera prediction dashboards that build off of cyclone predictions, and collaborative surveillance project sharing data across both their National Institute of Health and their Ministry of Health in Mozambique. So things are headed in the right direction, or maybe I say were until the election. So I guess we'll see what happens with the elections in Mozambique. There's turned out poorly like ours, but they have had multiple protests and civil unrest as a result. So that's not good. And I'll stop there on that, sorry, not great note.
That's all right. Thanks, James.
I can go next, Grace. So it's not a personal accomplishment, but a result of one of our previous campaigns came out earlier this year, which was really very satisfying and fulfilling. During the time of COVID, for 2 years, in India, we ran a malaria campaign using Facebook malaria ads. And our outreach at the campaign was named Bite Ko Matlo Light. So it's a Hindi plus English term, which means don't take bite or don't take mosquito bite lightly. And it was a full digital campaign, because you remember at that point of time, physical training or health education program was practically impossible. And the campaign was pretty successful. We created thematics, a full-fledged, content around not just prevention of the disease, but also caretaking for febrile illnesses, so on and so forth. At that point of time, the outreach and the analytics from the campaign was pretty encouraging for us. World Bank parallelly did a randomized controlled trial to find the impact, and the result has been recently published, and it was an independent study by them. So they have provided the result that probably in somewhere around 30% decline in the number of malaria cases in the health facilities happened across 80 districts in over 8,000 sample size in the areas where the campaign covered. So this was really encouraging and impactful, running that campaign in the country. And 4 years later, when you see that at this large scale, because 80 districts in India practically means 40 crore people, or even maybe more. 40 crore means maybe, for how much? A million is 10, so 10 million is 1 crore, so 40 crore is something like 400 million or something like that. So this is an impact at that level. This was really fulfilling to understand.
Yeah, Kaushik, if you have the link to that news, I think it was some sort of publication, was it a press release or some sort that kind of confirmed the results of that campaign, that'd be great to share in the chat. Thanks for sharing.
I'll pull it up from, I think World Bank shared over email as well, the study publication link itself. So I'll paste it in the chats.
Okay, great.
Grace, I can go next.
Sure.
Yes, I think mine was a response to an outbreak for Rift Valley fever in one of the rural areas in Kenya. The most interesting part was we looked at the vectors plus humans and livestock plus wildlife where were possible. And as you were doing it, we also found out that the same locality between rural and township and nomadic cycle, we find that malaria was actually profound in the same region, but just a road that separates a place where malaria is prominent and the other places where Rift Valley was quite prominent. And one of the interesting find was we collected vectors. We didn't find Anopheles on the other side that actually RVF was very prevalent, but we found we found the other vectors, that was Culex and Aedes aegypti. And the most interesting part for the study was that we found that Culex were the ones that were infected with Rift Valley fever. That showed that the infection or the outbreak was like supposed to be continuous, because the cycle for acute infection and outbreaks usually happens for aegypti. So that was very interesting for us, and to try to find out that the place where Anopheles was, we found Anopheles was because the major difference between the road was the rain, and sometimes it was a little bit colder and the other was a little bit warmer. So it was quite interesting, although it's a study we haven't published. So I think that was one part of what I felt was quite interesting to me. Thank you.
Thank you, Dr. Moel. If there are any kind of preliminary findings or an eventual publication, it'd be great to have that as well sometime in the future.
Sure.
There may be one or two more people who want to share something from this past year. All right, I think we could go ahead and move on then. So I'll put the link to some of the publications in the chat right now. I added the Lancet countdown in there since it's quite relevant to what we're doing, and many of you are probably also already tracking that. All right, so just quick recap of the 2024 IMACS network activities. So we have not convened much as a full group, but we've stayed pretty active in some of the other kind of smaller groups.
Thank you so much.
So just first looking at proposals, we've collaborated with members of the expert network on funding opportunities with the Belmont Forum, the Takeda Corporate Social Responsibility funding opportunity, and the Global Fund. So we're still waiting on a lot of these to come through. But I think this was a helpful way this year to build kind of what we think could be funding consortiums for the future for the IMACS Expert Network. And at any point, if there are any funding opportunities that come your way that you think would benefit from additional experts from this group, I'd be more than happy to start coordinating or help connect you with other folks in the network. So another activity stream, I'll call them, were conferences. So we co-hosted sessions at the SRI Congress and ASTMH and the Forecasting Healthy Futures Summit. We have a few people here from the ASTMH this session. So I'd love your take on how that session went and any thoughts on follow-up. I know we had discussed maybe putting together some sort of write-up afterwards, but we have Bill, James, Kate, and Kaushik who were in that session. And I believe, Sadie, you may also have been at ASTMH last week. So just any reflections from the past week of lots of walking and a lot of content as well. Would love your input there.
Clearly, it was the best session of the entire conference.
Well, we got a pretty significant draw for 8 a.m. in the morning on the last day, I would say that.
That was very impressive, actually, on how many people showed up.
That's
think
an encouraging compliment, Bill. And it's coming from you, and that's awesome.
I mean, I think that anything that we can do to sort of continue the conversation, I think we just honestly touched on the surface of the topics that we were that we brought up during the session. I mean, and personally, I would really like to delve deeper into what Kate talked about and some of the evaluation ideas that she had, because I think that those are really great ideas, and see if there are opportunities to kind of flesh that out further and test them out somewhere. Beyond that, like in terms of like, white papers or, I don't know, position papers, I don't know whatever would be best based on the symposium, but something I think would be good for sure. Like I said, I think there's a lot of good information there.
Yeah, and for those who were unable to attend or did not get to see the symposium abstract, it was kind of going through almost like the life cycle of a early warning system development, starting with the design and ideation phase into implementation and then evaluation. Of course, there's so much that we could have talked about in all of that, but we had an hour and 45 minutes to kind of go through briefly each piece. So James, I think, and everyone else on the call, we can follow up and figure out maybe a quick check-in on what we'd like to do in terms of expanding that discussion into some sort of write-up or other kind of output. And I know, Sadie, you briefly came on camera. I don't know if you wanted to add something to the discussion there.
I met there right after the conference. I think our session, Grace, and
Yep. I got to meet Dr. Kaushik in person.
Amazing.
That was lovely.
James, we also have a blog. I think I'm not sure you have received the link yet, but Mindy put together a nice blog after this. So maybe we can share that with you all for sharing in your social, and then figure out if we can put together something more formal in terms of what we discussed during the symposium.
I do want to do a shout out to Mike Wimberly, because there was a question from CDC on how these systems can be used for West Nile virus. And I told the CDC person that they should check up on what you're doing, because it's exactly what you're doing. And I don't, apparently he was aware of the work that you were doing in the Dakotas, but I'm not exactly sure why he was confused that it couldn't be used for other states, but maybe I
Do
misunderstood.
you remember who it was? I can reach out to him.
John Painter.
Oh, I know. Okay, I know John. I'll follow up with him.
And Kate,
Thanks,
you have your
Bill.
hand raised.
Yeah, thanks. And thanks, James. Yeah, I would love to sort of have something that is focused on the evaluation aspect, and something that's, I just had a bunch of ideas, but something that's more, thoughtful. And then again, like what you were saying as well, is like looking for, a real-time opportunity to do an evaluation would be ideal. And, there's funding opportunities in Canada, and we could also look elsewhere, but yeah, I'm definitely game. And I was thinking maybe even a comment like in, Lancet Global Health or something, like where they publish, and PNAS, like I wherever they publish early warning systems might be a nice kind of call to action as well.
And I'll just put the blog post that summarize the symposium discussion, and then I'll also put kind of the malaria specific one in the chat here. This is all compiled by Mindy, who is our comms person on the ground at ASTMH this year. So if it's worthwhile to give that a look or share that on social media, please do. We'd love for you to kind of promote the work that you all have doing, and continue to kind of share the work you all are doing, which kind of leads me to my next stream of work here on blogs that have been shared on our website as a way to dive a little bit deeper into some of the work that you all are doing in your specific research. And the blogs are just kind of like one-on-one interviews done by Mindy, our comms media comms manager at Malaria No More. So she's done a few with some folks on this call already. And if you're interested in kind of having that conversation or sharing a little bit more about your work, we're more than happy to schedule that and promote that on socials. So I'll also put in the chat some examples of what those interview blogs have looked like. And then lastly, just to share that we've done kind of a joint webinars with other existing networks, and hope to kind of model that sort of collaboration in the future. If you're involved in any research groups, other networks that would be interested in collaborating on webinars or content in the next year, please do flag for me, and we can start to plan a little bit more ahead for the next year. All right, at this stage, I'm going to go ahead and move on to upcoming events and opportunities. These are two conferences that I flagged. So the DHIS2 annual conference happening next year in Oslo, with some cross-cutting themes that I found are quite relevant. DHIS2, that team also hosted a webinar just before this meeting. I wasn't able to attend, but they had a climate and health specific webinar, and I can share that afterwards. James, go ahead.
Yeah, I didn't finish that webinar, but it is recorded. It's on their YouTube channel. I was watching it. I would say it's got promise, but it also probably has a long way to go. It's going to require a lot of help from us experts to kind of filter through. I don't know who is involved with creating it, but it's called CHAPS. It's basically, they've created a tool. I think it links to DHIS2, where you can download climate data from Google Earth Engine. They only really mentioned Euro 5 and then CHIRPS data. So I don't know if they have access to other things, or if that's something you have to build in yourself. as well as linking to specific models, like mathematical or statistical models for prediction, like EWARS plus. So that I think that there's some potential there, but again, like if they haven't gone through and vetted any of the models, or if they haven't worked with the countries to make sure that the countries know what they're using and taking advantage of any other work that's already been done, I think that, obviously this is one of those things that could either die on the vine or produce maybe more harm than good in the end. But I think that there is, at least they're doing the right thing about working with different countries and ensuring that those countries have access to or agreements between Met departments and ministries of health and things like that. So I think it's definitely relevant to everything that we're doing and talking about. So I would recommend watching the webinar, maybe on 1.5 speed or something like that, if you have the chance. Thanks.
Thanks, James. And I saw, Mike, you came off mute. Did you want to add something there?
No, yeah, I was just, the Google Earth, just a couple of thoughts. One is that if they're linking to chirps, I know they've improved the latency of chirps a little bit, but I think it's still at least several weeks. And so that's, it's not clear whether that, CHAPS is really set up in a way that could drive near real-time stuff. The other interesting thing is Google Earth Engine, which, I've used, but, I would note that if you actually look at the fine print, you're not, if you use Google Earth Engine for anything operational, even if you're a university or a nonprofit, they actually want you to pay for it to get a subscription. Although I don't think that's ever really enforced. And they don't really talk about it when they're pitching the whole, Geo for, Google for good sort of thing. But just a couple of thoughts when that was brought up.
Sadie, did you want to add something?
I was just underscoring Mike's points about the not actually as free as it seems issue. The other Google Earth Engine thing that I keep running into is storage. And that's when it becomes very much not free.
Yeah, free-ish.
Yeah, free adjacent. That's all.
Thank you, Sadie. Thank you, Mike. So it sounds like there might be a lot to talk about about the potential of DHIS2. So maybe that's something to maybe hold and think about, whether folks would be interested in kind of analyzing the current use of DHIS2 and how they're using it for climate and health. And then the other conference I flagged, just with the submission deadline coming up quite soon, is the SRI Congress. It'll be held in Chicago next year in June. And IMACS previously hosted sessions in 2023, 2024. Bill was in person for 2023, and then we had Sheetal Salal at our 2024 SRI Congress. So another great way to kind of get involved and if you are hoping for a trip to Chicago next year, that might be another opportunity to collaborate. And their themes tend to be quite relevant to the work that you all are doing. And if there are any other conferences or opportunities that you can think of, please feel free to flag them in the chat or at a future meeting over email. Again, really happy to figure out ways that we can collaborate as a network. All right, so we're diving into our discussion piece of the agenda here. This is about our global consultation for climate and health data integration. We'll start with a brief overview of the Climate Smart Indonesia National Consultation. preview of the global consultation that'll happen on December 10th. And hopefully we can have a couple of you attend if you're available. If not, we're also happy to schedule one-on-ones to get your input on the data integration piece. So I'll pause here and pass it over to Kaushik and Naufal to lead us through the remaining around half hour of today's call.
Thanks, Grace. I won't take much time, so I'll just give an overview of what it is, because after all this, we have just started talking about Indonesia. So, the Climate Smart Indonesia initiative we launched it in 2023. And the partnership was between the AI Industry Association of Indonesia, KORIKA, the Mohammed bin Zayed University of Artificial Intelligence in UAE, and IMACS, 3 institutions. We work together, and with support from the Reaching the Last Mile, and in partnership with the Ministry of Health, Ministry of Environment, Forest, and Climate Change, and the Meteorological Agency of Indonesia, BMKG, we launched the Climate Smart Indonesia initiative. So this initiative aims to design and implement a multi-disease early warning and response system to address the growing threat of climate-sensitive infectious diseases and public health problems in Indonesia. And we leverage artificial intelligence and cloud technologies introduced through the partnership between IMACS and MBZ UAI, and the extensive local network and the convening capacity of KORIKA, plus the support that we are receiving from the different government institutions or public institutions in Indonesia. Now, the government of Indonesia has consistently emphasized the importance of integrating and standardizing health and climate data to improve early warning systems and enhance public health decision-making. In fact, in 2023, the UNICEF, the Ministry of Health of Indonesia, and the Meteorological Agency, BMKG, they emphasized the urgent need for a robust, standardized health data system and called for integrated digital platforms to strengthen early warning systems, improve disease surveillance, and enhance resilience against future climate and health-related threats. In 2024, the urgency for standardizing and setting a blueprint for integrating climate and health data was emphasized by the BMKG during a Climate Smart Indonesia workshop and the signing ceremony of the MOU between BMKG and KORIKA. So in response, Climate Smart Indonesia partnership with support from the Patrick J. McGovern Foundation is preparing a blueprint for integrating climate and health data in Indonesia as a reference framework for climate health data standardization and interoperability for learning health systems. And this is probably one of its kind blueprint that we are trying to develop for Indonesia and set an example for other countries in the region and also globally, that how this could be done. We already had a national consultation meeting in Indonesia where 6 of their ministries and government agencies, including the 3 I mentioned earlier, as well as Satu Data Indonesia, which is the Indonesia government's initiative to pull together the entire development sector data, and 2 other institutions or ministries, BRIN, which is the innovation agency of Indonesian government, and others, they joined. And we had nearly 80 participants joining the nearly full day meeting, where we had 4 sessions of discussions, completely interactive, to identify the way forward for the Indonesia government to integrate climate and health data. Now, the next part of this body of work is the global consultation, and we have already started drafting a report as well. So Naufal, who is the consultant from our Indonesia team, so he will be presenting briefly some of the findings from our ongoing research as well as the national consultation meeting. And post that, we will ask your guidance and support in terms of or insights in finalizing this, and of course, a more detailed deliberation on that during the global consultation. So if you have any immediate questions, otherwise, I will turn to Naufal for the presentation.
Wonderful. Thank you, Kaushik. Let me share the screen. Yep. Can you see the screen? Cool. So yeah, hi all. I'm Nofal. You could call me just Fall or Nofal. And yeah, I am here. I help Dr. Kaushik and Grace for climate health project, right? In Indonesia. I'm Indonesian, and yeah, we work together collaboratively to give the guidelines, right, and these blueprints. To give you context, right, at 21st of October, as mentioned by Dr. Kaushik, we had the blueprint consultations, right? And this is the brief, right? The brief of the insights, as well as the analysis and the recommendations. What is happening in Indonesia? Hopefully, you could it trigger another insights as well as your thought, your expertise in here. Yeah. So to give introduce myself first, and my background is actually engineering, and I have my specialization in data science and few years in consulting firm. And yeah, so to give you context in here, Indonesia is actually one of the fourth largest populations in Southeast Asia, and we are like top 10s of GDP, economic GDP, right? And we also have like high risk exposure to dengue as well as malaria, because we are we are in the equators, and we are the second largest rainforest country. So rising temperatures and changing rainfall patterns and extreme weathers even have been linked to increased case of dengue, malaria, respiratory conditions, just like tuberculosis, with 30 until 50% increase in reported cases during period of higher than average rainfall. And Indonesia was ranked 14 out of 180 countries in 2019 in the Global Climate Risk Index, right? So it contributes the spread of vector-borne disease like dengue, malaria, and so on. And like there are 130,000 reported cases of dengue fever in 2021, and we have like bunch of applications, web application from the governments, but it's still silos, right? And what we try in here is actually we try to bring these consultations right together among other stakeholders from NGO, from international entities, from government agencies, environmental expertise, to discuss the blueprint for integrating climate health in Indonesia, right? So we're creating 4 points of value in here: expertise in data integrations. Second one is actually interoperability standards, facilitating cross-sectoral collaborations, as well as strategic roadmap and policy recommendations. And yeah, so like we see that 5 pillar challenges, right? The brief challenge that we see in Indonesia especially is one is actually data integrations and interoperability. So we quite scatter, right, and silo. We unified the data and as well as the application yet. And the second one is actually the predictive models. So implementing predictive models and real-time monitorings, right, and enabling it to detect health risks is quite challenging in Indonesia. The third one is actually cross-sector collaborations governance, right? So we see like bureaucracy and ego sectoral in each government entities is primary driver for blockers, right, in collaborations among other entities. And the fourth one is actually capacity building and training. We have digital skill, but the rate is quite low, right? We need reskilling, upskilling for this kind of data and expertise. And the last one is actually policy and regulatory framework. We have few legal frameworks as well as the policy, but it's not comprehensive yet, right? In terms of ethical data use, AI integrations, as well as the privacy data, right? And this is actually the existing approach, right? That we see, right? That I think Dr. Kaushik already mentioned before, like Satu Sehat platform, right? As well as Satu Data initiative, right? So this is actually one of the initiative from government Indonesia to unify the data, right? But this kind of approach have similar redundancy, right? Some of entities has on their own platform like Pusdatin and so on, so GovTech and so on, right? And third one is actually BMKG collaborations. We have like MOU from another AI agency like Corica, a pilot program in high-risk areas, regulatory foundations, data standardization framework. We start to adopt interoperability standards and international partnerships, right? What we see the strategic priorities in here is actually establish a unified data infrastructures, enhancing regulatory and ethical frameworks, and investing workforce for training, as well as community engagement. So this is actually what is quite interesting, right? So this is actually the data from one of the government agency, is BNPB, is specialized in disaster, right? It's gathered in 2020. In that BNPB alone, we find that 30 web-based platform applications, right? The most large one is actually called Inaris, right? It's responsible for previous outbreak of COVID-19. And yeah, so the lot of applications and silos data is lowering the value added, right? There's two gaps that the analysis have mentions. First one is actually translating advancements, integration, and interoperability. And the second one is actually limited feedback, right? Feedback mechanism, right? And this is actually a line that we also see in the consultations that they are bring up in UNESCO or Cominfo or Ministry of Communications readiness assessment, right? The first one is actually the fragmenting data, limited standardizations, gaps in data privacy and security, and early stage of AI and data ethics. This is actually the gap that we see, but we also see this is actually all have the improvement in the early stage. This is actually what we are see, right, as a new transition for solutions. Actually, the partnership models, like the PPP models, like, right, public partnerships. This is actually already happens in Indonesia in Ministry of Industry to creating more use case in startup for 5G use case. And this is actually what we see as well in climate health and risk. This is right. We have the ministry, the BMKG, the Ministry of Forestry, Corica, the AI agency, the tech and the tech startup and tech firm corporations, the academic and research institutions, a research agency, local governments, as well as the international agency and international entities as well for collaborations that we call pentahelix collaborations. That's Indonesian jargon, by the way. And yeah, this is actually the strategic roadmap, right? After realigning the zero phase, the foundational setup, to realigning each of the entities in Indonesia, we could also, the quick win for this one is actually build the initial infrastructures that have integrations for each data warehouse and and each of the data that they have gathers, right? And the second one, actually develop the interoperability standards, right? There are of the standards like IEEE, HL7, and it's still scattered. And the next one, actually conduct initial training programs to make sure it's aligned and we have the same skill set and the visions for make it come true and sustainable. And yeah, this is actually the quick win approach to solve current gap, right? Develop data sharing protocols across agency and create centralized data repository. We have a risk in here. There are silo systems, and sharing of frequency is not standardized yet, and user engagement, adoption, and response time reduction in health emergency. We see the risk in here as a legacy system should be sustainable, should be commitment across entities, right, that could maintain the data as well as the service, right, for the society as well as Indonesia. I think that's it from these presentations. Hopefully it could bring an insight from for you and offer to you, Dr. Kaushik. Thank you.
So Grace and I discussed a few questions, and you know, these are the questions we would love your reflections in the next 10 minutes or so, and maybe even more in follow-up one-on-ones or during the global consultation meeting. But we would love or really appreciate, you know, thoughts from your experiences. You all have practically laid early warning systems in different contexts and different settings, and we are trying to solve the problem in a country. Those best practices and the learnings will be key to ensure that this document really becomes a standard for the Indonesia government, but also an example for the other countries to learn from. So if there are any immediate reflections, I'll pause, and then we can move through the 3 questions that Grace and I put together for some very high-level reflections from you.
And I'll quickly stop sharing my screen so we can just have a discussion here. Put the discussion questions in the chat, and then if you could give the second message a thumbs up if you're interested and available in attending this follow-up consultation meeting. This is kind of just a little preview snippet of the longer conversation we'll have in that meeting.
I had a question. Thanks for the presentation. I was actually wondering about how much, so I know that malaria, for example, exists in the Sabah state, right, on Borneo, but that's technically not part of Indonesia. But it looked like in the small maps that you had, you included data from that area. So do you do work in that Malaysian Borneo area also?
No. So I
No.
think the most malarious part of the country is Papua and West Papua at the moment.
Okay.
So right now we have subnational risk stratification in Lampung, Papua, and Lampung and Papua region for the country for malaria. And we have also started including dengue data, and where the models are there for forecasting dengue nationally. Between December and January, so data procurement is on for a 3rd disease. So we should be able to integrate another. So we are trying to make it really multi-disease. And apart from that, we are also doing a bit of weather prediction. So that is not what IMACS is doing, but it is done by our partner at MBZU AI. So they are using the Japanese satellite data, which provides 10-minute frequency data, and they are using that to forecast temperature, humidity, and rainfall, and that is being provided in a digital twin system. So there are two types of predictions happening, and one is at the national level, and then at subnational level for three specific areas: Papua, Lampung, and the East Kalimantan or something, which is the new capital of Indonesia, which is called forest capital, whatever they're calling it. So that's my response.
And are you doing any scenarios on the location of Jakarta, of the capital?
For dengue, yes.
For dengue, yes. Are you doing anything for malaria?
For malaria, we haven't got very long-term data. So it's for dengue, we have longer-term data. Malaria data is just 3 months DHIS2 data, because the data, 3 years DHIS2 data. Before that, data configuration was entirely different. So they changed to SysMal, which is the DHIS2 platform, probably 3-4 years back. So that is a different configuration of data. And now they are again moving to another type of data configuration with their own data center. So it's really challenging.
Yeah, that's interesting. Thanks.
So, what I can do is I can read out some of the questions if you have anything in mind regarding the challenges of data fragment. Please feel free to drop off, but we'll definitely share the link for the global consultation with you. So where we will not just have the network members, but I think we will be having another 10-15 members from the global community. So it's a kind of closed room discussion that we'll be holding. But yeah, and these are the 3 questions, and we will share with all of you a packet. We have a draft, an ongoing draft of the document that we are putting together at this point. Also have the planning of this blueprint, which provides that where from it came, what was the purpose for this entire document. I think Grace has put together, Grace has provided the link for the this document, which is kind of ongoing write-up from Naufal, and we are reviewing it live. And we also have this planning document for this and a few other things. So we'll be sharing with you all the packet, and based on that, and a few questions to think before you join that meeting, because I think those reflections will be really helpful. And one of the things I also would like to mention is the deputy chairman of climatology of Indonesia has been nominated, so is now the vice president of WMO. So what he has suggested is, this was the ask from BMKG, and particularly from this person, and he asked that if we can provide that, so if they will not just provide this to BMKG or the Indonesia government, he will also transfer it to the WMO as a kind of country case or a country example document, so that this can be translated for other countries. So that is the reason we are trying to set an example with this. But again, we need a lot more perspective that we have from Indonesia to put in there. Maybe a few good case studies or best practices. We would love to include all of them. And of course, answers to some of the high-level questions around partnership models, community of practice, what works, what doesn't work in your areas or places, and of course, any particular technical aspects like modeling and data you would like to highlight. So we would be having this. The one that Grace has already shared, we have chapterization for the large document there. So we will focus on those thematic areas in the final write-up, and we'll share with you those packets very soon. Grace, over to you.
All right, thanks Kaushik, and thanks Nafal. I think we can wrap it up here. Hopefully, this gives you kind of a preview, a taste of what that conversation, the longer conversation will look like in December. And I'll make sure to kind of follow up with you all to see if you're available to join. And if not, we can, again, schedule a separate call to go through your thoughts on data integration. So thank you all for joining. I think we can wrap up with 2 minutes to spare, and hope you have a good rest of the week. Good to see you all.
Right. Thanks, Grace.
Thank you all.
Thank you.